Welcome to another exciting episode of In-Depth Eye Health podcast series brought to you by iFocus and EyeHubNigeria initiative. The series provide incredible insight into topical eye health issues and also serve as a platform for continuous professional development for eye care workers. Thank you as you listen. Hi everyone, I'm Ifeanyi from EyeHubNigeria, an eye health awareness initiative.
Hi, I'm Dr. Mustafa Bature from iFocus, an online platform for advancing eye health through shared learning.
This week is World Glaucoma Week, and today we'll be discussing glaucoma, the silent of sight. We'll be dispelling some myths surrounding it, what it is, who is at risk, and how it can be managed, among other things.
Our guest for today is Dr. Tarela Sarimiye, a consultant ophthalmologist and glaucoma specialist at the University College Hospital, Ibadan, Nigeria. Thank you for joining us, sir, today.
Thank you for having me. It's a pleasure for me to be joined at this podcast presentation for us to discuss about glaucoma. Thank you.
Thank you, Dr. Sarimiye. So now there's been a lot of issues, a lot of talks going on this week about glaucoma. So what exactly is glaucoma?
Yes, glaucoma, simply put, can be described as a group of eye diseases that have a common end result, which is the damage to the optic nerve. This nerve is what connects the eye to the brain. It's like referring to it as a cord connecting a photographic film, which represents the back of the eye, to the brain. So that cord enables the photographic film images to be interpreted. So in situation whereby that cord is damaged, there is a disconnect between the eye and the brain. So there won't be interpretation of that film. And in that case, the person has lost his vision. Thank you.
Yeah, why is glaucoma often referred to as the silent thief of sight?
Yes, it's a very good phrase that was coined some years back to put forward the nature of glaucoma. This is because most glaucoma are painless, they are without any form of symptom. So an individual may have glaucoma occurring in his or her eye for many years without having any symptom of sign until the glaucoma is quite advanced. That is when they now become symptomatic, as in they now have the feeling of poor vision. So because of that long period of gradual progression without showing any symptom or sign for the individual to appreciate that something is wrong with his eye, it is termed a silent thief because it gradually eats up the individual's vision. So it's a silent thief of sight because it silently, gradually, progressively eats up an individual vision without him or her knowing that something is happening in their eye until it is quite.
Okay. This week, March 8 to 14, 2020, is World Glaucoma Week, and the theme is BIG, Beat Invisible Glaucoma. What is the significance of this theme in relation to what glaucoma represents?
The Beat Invisible Glaucoma was a term coined about 5 to 6 years ago by the World Glaucoma Association and the World Glaucoma Patient Association in a bid in marking the World Glaucoma Week, which occurs every second week of March each year, in increasing the awareness and advocacy for glaucoma. And the phrase "beat invisible glaucoma" was chosen because most glaucoma, as I earlier mentioned, are asymptomatic. They gradually progress in an individual eye without any sign or symptoms. So it appears an invisible disease in their eye that over a long period of time before it becomes symptomatic. So how can this be handled? Whereby currently most patients present in the late stage of disease, why it would have been better for them to present much early when they are asymptomatic. So how can we reverse this trend of them coming very late. So that is why the term beat invisible glaucoma was coined. And in so doing, is to improve awareness for people to check their eyes more frequently so that the glaucoma can be picked at an earlier stage and so it can be halted as much as possible. Progression slowed that it won't get to the advanced stage, and also to increase the advocacy drive with regards to policymakers, governmental agencies to change the paradigm in eye care generally, but for glaucoma care services specifically, so that most patients can have care for glaucoma should in case they have it without the bottleneck of no healthcare services around them to handle that, or lack of funds to take care of it. So the Beat Invisible Glaucoma is a drive by these two associations to try and increase the awareness and also advocacy for policymakers to change the paradigm to help patients or individuals have better access to glaucoma care and services. Thank you.
Yeah, glaucoma is known to be the leading cause of irreversible blindness in the world, and Nigeria inclusive. Who are more predisposed to having glaucoma?
Yes, glaucoma is an enigma because the exact cause of glaucoma is not still known. As I mentioned earlier, glaucoma is a group of eye diseases. The commonest of this group is primary open angle glaucoma, which is also the commonest in Nigeria. And the majority of people with primary open angle glaucoma is symptomatic until they are in their very late stage of the disease. So since we are concerned about who are to be worried about glaucoma in this sense is that we look at risk factors. The exact cause could not, as at now, cannot be identified, but there are some identifiable risk factors that if individuals have any of these risk factors should heighten their desire to have their eyes checked. And first on the list of this risk factor is increasing age. The older an individual is, more likely he or she may develop glaucoma. A typical example is a 20-year-old and a 60-year-old listening to this broadcast now. It is expected that the 60-year-old should have more heightened desire to have his or her eyes checked than a 20-year-old because the likelihood of glaucoma is more in the older age than in the younger age. The second risk factor is race. It has been shown that the black race or people of African descent have far more increased risks of developing primary open angle glaucoma as compared to other people, specifically comparing to the whites, about 4 to 7 times more risks in having glaucoma than the whites. So because of that, blacks generally should have an increased desires to have their eyes checked. And the third risk factor I want to mention is family history. If there is a family history of someone with glaucoma, it is better that members of that family, especially first degree relations, should have their eyes also screened. So we have a parent, a sibling that has glaucoma, then others within that family bracket should have their eyes also screened for glaucoma. It's very important. Then other risk factors include raised eye pressure and thin cornea, that's the front of the eye, thinner than normal. These people are also at heightened risk of having glaucoma. So should in case someone walks in to have a general eye screening and it was found that their pressure in the eye is high, such an individual have an increased risk of having glaucoma. They need to have their eyes checked regularly. Thank you.
Okay, thank you, Dr. Sarimiye. It is said that glaucoma has no cure. So what does this mean for someone who has just been diagnosed with glaucoma?
Yes, glaucoma has no cure currently, which is unfortunate, but a lot of efforts are being put to see what can be done. Let's hope in the nearest future that statement can be changed. But we have means of managing, treating, or controlling glaucoma, just as we have in cases of individuals with diabetes mellitus, which there's really no cure. but with medications, with diet change, with weight loss and other mechanisms, diabetes are being controlled. So also for glaucoma, with the use of medications, surgery, or laser treatment, the glaucoma is controlled. The aim of treating glaucoma is basically to bring down the pressure to a level whereby the glaucoma rate is slowed as much as possible, that is not different from an individual that doesn't have glaucoma. So someone who is just diagnosed of having glaucoma should not be worried. He should just allow his eye care professional to choose the best option for him or her, because the treatment of glaucoma is individualized. Mr. A treatment may be different from Mr. B, depending on other parameters that are seen in the eye. So the best option of treatment will be given to the individual, and they will remain sighted if everything is followed. As the most important thing, early detection is very key. So people who are seen early, their glaucoma are kept in the early stage, and as such, they won't be bothered about going blind from glaucoma. Thank you.
Yeah, towards a better management of glaucoma, we know glaucoma has no cure, but what efforts are being done at national level, even global level, to curtail the progression of glaucoma?
Glaucoma. Yes, glaucoma is one of the avoidable causes of blindness. And since there is no cure, the aim, the paradigm shift has been to identify glaucoma as early as possible in individuals so that the progression is halted and they remain sighted. And globally, World Health Organization and International um, Agency for the Prevention of Blindness, as far back as 1999, brought forward Vision 2020, for which Vision 2020, the right to sight, for which glaucoma was one of the key diseases that were uh, put forward to try and avoid needless blindness from. And a lot of things have been done globally from then in terms of trying to change healthcare provision and government policies in the signatory countries to help improve the care of glaucoma. Also, the International Council of Ophthalmology, ICO, has drafted over time, and I think the last one was in 2015, bringing out guidelines for glaucoma care. In this way, trying to standardize the care that is given to glaucoma patients globally, so that we will have the best possible care for each patient and the needless blindness from glaucoma is halted. Nigeria is a signatory to the Vision 2020, and I could remember in the Ophthalmology Society of Nigeria conference in 2018, the vice president commented that an increased drive to achieve the objectives of Vision 2020 will be made by the federal government. And to this effect, last year, a major success was recorded, whereby the primary eye care was added to primary health care. Before now, eye care generally is a standalone care facility in the country, but with the addition of primary eye care to primary health care at a federal level, this will improve the access of the populace to eye care treatment at the primary level. And by this, more information will get to the people easily from the primary healthcare centers, and identification of these conditions, including glaucoma, can be done early and referred to the appropriate centers for appropriate treatment. So I think both globally and nationally, things are being done to try and improve the services available for the care of glaucoma to prevent needless blindness from glaucoma. Thank you.
Thank you, Dr. Sarimiye. It's been a really exciting time with you today. So what parting words of advice do you have for our listeners about glaucoma?
Yes, as this is the World Glaucoma Week, and there's an heightened advocacy and awareness going on, we advise the populace generally to have their eyes checked from reputable eye centers, let them have the general eye check. And from there, those that have glaucoma can be picked up early and treated appropriately. They should not assume because they have perfect vision that there's nothing wrong with their eye. As I mentioned earlier, glaucoma, as a silent thief of sight, does not produce any symptom until the individual is about 90% or more blind from glaucoma before it becomes symptomatic. So early detection is very key, and to ensure early detection, these general populace should have their eyes checked, specifically those that have family members with glaucoma to have their eyes checked, those that are older age groups to have their eyes checked, and if they check, they should have an intermittent period of having it checked based on the recommendation of their eye doctors. Thank you very much. It has really been an exciting time.
Thank you very much, Dr. Sarimiye, for your expert insight on this topical issue. I will have my eyes checked during this World Glaucoma Week. It has been a pleasure having you on the program today.
Thank you for having me. Thank you, Dr. Baturi and Dr. Moye. This is truly an exciting time, and keep the good job going. Thank you.
Glaucoma is the second leading cause of blindness and the leading cause of irreversible blindness, both globally and in Nigeria. In Nigeria, it affects 1 in 20 people aged 40 years and older, and 1 in 5 of these is already blind at the time they present for care. It is called the silent thief of sight because you may have it and not even know until it is too late. Early detection is therefore key in preventing blindness from glaucoma. Don't let your vision be stolen by the silent thief of sight. Be sure to have regular comprehensive eye examinations. It's World Glaucoma Week. Together, we can beat invisible glaucoma.